One of the most dangerous things about cervical cancer is not just the disease itself, but how easily it can go unnoticed. Hi, welcome to Nurse NES Space. Today is day 2 of our 3-day awareness series on cervical cancer, and today we will discuss the symptoms, common myths, and misconceptions of cervical cancer. Let's dive in, guys. Cervical cancer often develops slowly, and in its early stages, there may be no symptoms at all. This is why regular screening is so important. However, as the disease progresses, some warning signs may appear, including abnormal vaginal bleeding, bleeding between menstrual periods, bleeding after sexual intercourse, bleeding after menopause, unusual vaginal discharge, persistent discharge that may be watery, foul smelling, or blood stain, pelvic or abdominal pain, pain in the lower abdomen or pelvis that is not related to menstruation, pain during sexual intercourse. These are warning signs of cervical cancer. If you spot any of these signs, seek medical help immediately. Misinformation is one of the biggest barriers to prevention. Let's clear the air, guys. Let's talk about the common myths and misconceptions. Someone will say, I feel healthy, so I don't need screening. That is a lie. Cervical cancer can exist without symptoms in its early stages. Screening dictates changes before cancer develops. A young lady will say cervical cancer only affects older women. That is a big lie. While it is more common in women aged 30 and above, younger women can still be affected, especially with persistent HPV infection. Someone will say only women with multiple sexual partners get cervical cancer. Well, that is a lie. HPV can be transmitted even with one sexual partner. No one is completely risk-free. Cervical cancer is a death sentence. No, no, no. When detected early, cervical cancer is highly treatable and survival rates are very high. Another one will say cervical cancer is not preventable. That is a lie. It is highly preventable through HPV vaccination and regular screening. Screening is painful and dangerous. No, no, no. Screening procedures may be uncomfortable but are generally safe. In conclusion, cervical cancer may be silent in its early stages, but knowledge gives it no hiding place. Symptoms do not always mean cancer, but they should never be ignored. Knowing the warning signs and debunking myths empowers women to seek help early and make informed health decisions. No concern is too small to be checked, and no woman should lose her life to a disease that is largely preventable and treatable when detected early. That will be all for today, guys. Next on Let's Talk Cervical Cancer is prevention. Tomorrow we talk about how cervical cancer can be prevented. When you know better, you protect yourself better.